When I think of resiliency, particularly because of the events that occurred over the last 3.5 years, I think about the providers, the behavioral health providers whose funding and businesses were totally taken away from them because of actions by the Health and Human Services Department of the state of New Mexico. Easter Seals had been in the northern New Mexico communities for 42 years, serving developmentally disabled adults and severely emotionally disturbed children. Losing that funding practically devastated our entire organization. We lost $16 million in revenue. We lost our business, and we had to lay off over 100 employees. We had to figure out, how are we going to survive financially? How are we going to continue to be fiscally sound? And how to continue to provide quality care to the individuals that were still under our care. And we were determined to do that, but we couldn't do it alone. We had hundreds of volunteers that came forward from the community who knew that we were dedicated to this work. Our employees continued to work with us. Even for those individuals who lost their jobs, they continued to try to find ways to continue to care for their families, to communicate with them, to try to figure out how they could engage them back in treatment, to continue to dialogue with us about how we could take care of those people that we needed to serve. And so today, Easter Seals is financially stable, and we are able to meet all of the demands that are required in order for us to provide quality care. But we did it together. And that, in my opinion, is the very definition of resiliency. Making those hard choices, but making them together in community so that we can continue to do the work that is near and dear to our hearts.